Hi, my name is Teresa Garren-Grubbs, and I am a clinical assistant professor in the College of Nursing at South Dakota State University. Today I'm presenting my work entitled Preparing South Dakota Farm and Ranch Women for Advanced Care Planning. Well, nationally, it is estimated that 36% of American adults have an advance directive. In South Dakota, 31 to 35% of adults have one of these forms. For farm and ranch women in South Dakota, which was my population of interest, through a brief needs assessment, 29% of participants reported having an advance directive. Interestingly, when the same group was asked if they felt prepared to talk to their families about healthcare wishes, over 80% of respondents felt prepared to have these conversations. This indicates that there is a challenge with communication and documentation of these medical wishes. Currently, there has been a shift away from advance directives alone to advanced care planning, or ACP, as a process. In the literature, some of the biggest barriers to advance directives and ACP identified include lack of knowledge by the lay population about these forms, as well as the advanced care planning process. The PICO question that guided this project was for South Dakota farm and ranch women participating in the Power of Women as Advocates conference. Does the implementation of an education session about advanced care planning conversations increase engagement in ACP and increase documentation of medical wishes in the form of an advance directive? The theory chosen to guide this project is the trans-theoretical model. Behavior change is considered a process, much like ACP. This theory is commonly used for studies related to ACP and speaks to the barriers of this process. A national standard does not exist for education and preparing individuals for ACP conversations. Prepare for Your Care, also known as Prepare, is an interactive online ACP program using behavior change techniques such as video short stories and interactive questions to prepare participants for medical decision-making. This intervention has shown promise for increasing engagement in ACP in the community setting. Prepare is often used in conjunction with the Advanced Care Planning Engagement Survey, which was developed to measure the impact of ACP interventions by detecting changes in 4 aspects: decision-making, quality of life, decision-maker flexibility, and asking doctors questions. This project utilized Prepare for Your Care as an intervention at a conference for South Dakota women in agriculture. The participants completed the Advanced Care Planning Engagement Survey prior to the conference, which was considered baseline. They then completed this 1 week and 3 months after the conference. There were statistically significant increases in ACP self-efficacy and readiness at 1 week, and statistically significant increases in self-efficacy remained at 3 months. The program objectives for this session were also met. This project sought to determine if an education session on ACP at a conference for women who farm and ranch would increase engagement in ACP, along with documentation of advanced directives. By comparing the results of the Advanced Care Planning Engagement Survey at baseline, 1 week, and 3 months after implementation. This study demonstrated that the use of Prepare during a session of a larger conference does have potential to increase self-efficacy and readiness, which are both parts of engagement, although further studies are needed. Increases in self-efficacy and readiness were seen 1 week after the conference, indicating that, at least in the short term, this program increased engagement in ACP in terms of process measures. At 3 months, increases in self-efficacy remained, while increases in readiness did not increase significantly. After the completion of the conference, the only communication with the participants was via email, requesting completion of the follow-up surveys. Engagement increased in the short time after the conference, but that was not maintained at 3 months after the conference. This could indicate that there's a need for continued follow-up with the conference participants. In conclusion, the use of Prepare for Your Care as an education session for women in South Dakota agriculture may increase engagement in advanced care planning for this population. This program shows promise for future use for SDSU extension programming. Thank you.